Good afternoon. I'm Dr. Generoso Roberto, and today I'll be talking about COVID-19 vaccine distribution prioritization for senior citizens here in the Philippines. Now, as we heard from the news, time and time again, the COVID-19 daily, the record for the COVID-19 um, daily infection rates is constantly being broken these past few days. It is indeed that COVID-19 is very prevalent here in the Philippines and the cases are still going higher and higher. Now, as the number of people being infected increase, there is a higher chance that some people will develop severe forms of it, which could lead into hospitalizations and eventually death, and sometimes death. And one sector of the community that are more at risk for these kinds of events are the senior citizens. It has been proven and it's been recognized by the different health organizations worldwide that indeed they are at a higher risk, and by their preventing the infection to this age group, we could lower down the mortality rate of this disease. And to and as a response, our government has organized and rolled out massive immunization campaign in order to vaccinate 70 million people here in the Philippines to achieve herd immunity so that COVID-19 could no longer become a threat. And as of now, at this stage of the vaccine rollout, the senior citizens are now the next in line. Unfortunately, a problem that arose is the lack of vaccine supply. All around the world, countries are struggling to get the necessary amount of vaccines for their constituents. And in this backdrop of limited vaccine supply, there is really a need for us to prioritize which areas this vaccine should be given to, so that in order to generate the most protection as well as to prevent unnecessary morbidities or death. Now, in order for me to accomplish this, I followed this methodology. First and foremost, I've collected data from the different agencies or organizations. I check those data, I look for duplicates or missing values. Then I feature engineer or I computed for the different rates per municipality. Then I look into the data, explore any possible insights, and eventually I've used these indicators to create a clustering algorithm using k-means. So k-means is a machine learning methodology wherein you would find the nearest neighbors or those that municipalities that have similar values to one another, similar attributes. So I look into four main factors that I believe could have an effect in the possible increase in COVID-19 cases as well as possible increase in the severity of the case. So first, the COVID-19 data, which I get from the DH data drop. For this study, I only included up till March 24, 2021. Next would be the population data. So how many people are there in the municipality or how population dense it is. Since has more people living in a close quarters could help spread the disease. Next would be access to healthcare. I look into the health facility bed, which include both infirmaries and hospitals, to determine the access to inpatient care in the different municipalities. Next would be poverty, since as we all know, being poor poses a hindrance in accessing health services as well as they have poorer health health data. Now, when we look into the different into the data, we could see that indeed COVID-19 is prevalent. Only 18 out of the 1,647 municipalities and cities here in the Philippines have no recorded COVID cases. As of now, 80% of all municipalities in the Philippines have new cases, but these varied the incidence varies widely from one municipality to another, from each in others just zero point 0.7 per 100,000, while on the others it's reaching 10,000. Now, in terms of access to healthcare, we see that 50% of all municipalities had no inpatient health facility, and 8 out of 10 municipalities only allocate around less than one bed per 1,000 population. Then we do the clustering, and with the K-means clustering, I developed four clusters. Cluster 1 is the smallest with 22 municipalities, followed by Cluster 2 with 186, next with 519, and lastly Cluster 4 with 920. So looking into the different Cluster 1 I would call metropolis-like. This is because they have the highest population compared to the other cluster groups. They also have the lowest poverty incidence. They have, on the average, more bed per population ratio, but they also have the highest cases of COVID-19. So this is our priority municipalities to be vaccinated. And examples of these are the cities here in Metro Manila. Our cluster 2 is what I call city-like. They don't have, they have a high population density, but not as high as those in cluster 1. They have also high bed capacity and low poverty rates, but not so much as that of cluster 1. And also they have more COVID cases, but not so much as cluster 1. So for this, they are city-like since they are smaller than the metropolitan, but they are also our second priority for our vaccine rollout. Examples of this are the cities, as we could look here, the lighter gray are the cities in Negros Occidental. For our third cluster, these are the semi-urban. They have low COVID-19 cases comparatively, so they are not we would not prioritize them in terms of vaccination, but we should also ensure that disease surveillance and disease prevention is still in place in this municipality. Examples of these are the municipalities in Zambales. And lastly, we have the fourth cluster, which I call the rural-like. Rural because they have low population, they have low population density, and also they have low COVID cases since the area is large compared to the population. They're not the priority in terms of vaccination, but they need health support in their health system. This is because these are the municipalities that are resource poor. Like what we can see, they have high rates of poverty incidence, and also they have the lowest bed to population ratio. So indeed, they need help in terms of the ensuring that uh, health services are being provided. Now, from the municipality, we go to the region, and at the regional level, we could see that each region has different mix of these different clusters. So, therefore, the regional strategy should be tailor-fitted to the needs of its constituents. Take, for example, NCR and Region 3, since they have high high numbers of priority municipalities, they should be the first one to be given the vaccine to be prioritized. And in conclusion, there are a lot of data being generated by the different agencies. Machine learning, such as K-means clustering, could be utilized to use the different data, health and socioeconomic data of the different municipalities to come up with stratification that could be essential in the planning for COVID-19 rollout and other services. Thank you very much.